So what is the difference between high power and low power PEMF machines? Hi, I'm Jerry Dreesen, the Executive Director for AOPP, the Association of PEMF Professionals. And this week we're going to dive into that. And I want to welcome those of you who are joining us for the first time, and also those of you that are not only members of the Association of PEMF Professionals, but are also certified members as well. And you can learn more about getting certification, all our videos that teach about AOPP, our research, all of that's on our website. But I'll just set that aside for the moment, and let's just jump into today's question. And people are often, they ask us or people that use machines, it's like, what is the difference between high and low powered machines? And let me just bring up my chat here real quick because I see some people jumped on. I just want to say hi to you guys. And I would say let's just get some basic concepts here. So PEMF is a pulsed magnetic field. It's not like a magnet, so you're not putting a magnet directly on the skin, which is a certain type of energy. This is a man-made version of what happens naturally. So real short, the sun sends magnetic energy. It bounces around the earth from the earth back up to the ionosphere, and it creates a frequency, and that's our Earth's magnetic field. And we can harness that frequency, we know exactly what it is, and create different versions of it. So now we have these big machines that have all this power, like up to 1.5 or even sometimes 2.1 Tesla, which add 6 more zeros. Now you've got Gauss all the way down to like 0.000 Gauss, which is a very micro tiny amount. So how does one work better than the other? And I think for me that the best way to talk about that, we've got frequency, we've got intensity, we've got waveforms, but I love working with visuals. So let's visualize a dry sponge, and I'm gonna set that right here. And now I've got this big bucket of water, and over here I've got this eyedropper full of water. So now I'm going to take this sponge and I'm going to dip it into that bucket of water. It's going to soak all the water up. Well, that's what a high intensity or a high powered PEMF machine can do. It's sending a lot of information, a lot of frequency. It has a deeper penetration. It covers more area, and it pretty much allows your client or yourself to soak up more of that PEMF for the designated area. Whether you're lying on a mat or if you are, using the different attachments, whether it's like a double ring or a large loop. And again, you can see that with the overall, different attachments, it can cause the muscle contractions when it's got a lot of high power going and things like that, but it doesn't even have to touch the person. And that's also the difference between PEMF and an electrical modality, like for physical therapy, where you have to take an attachment and stick it on the skin or shave the area and put it directly on there, like a TENS unit or ultrasound. PEMF is not that. It's not considered an electrical modality. So stepping back over here to the eyedropper, now you've got the same dried up sponge and you're putting little drops of water on it. It's not going to soak all that water up like it does in the bucket. So it takes more time. So the big difference between a high powered machine and a low powered machine is time. And it may not penetrate all the way through the body with a low power, but it will help out the area over time. So it's like a mat that you can sleep on, and it's just super low power, or it's a device that it's a wearable, so you can put it on the area and wear it all day. If you need to treat an area over a shorter period of time, then a higher powered PEMF machine works better. So you can do a 10-minute treatment time on high power, but it could be an all-day treatment on low power. So that's kind of the gist of the two. So when you're working with a high-powered machine versus a low power. And the other thing too is those of you who take the course and get certified know that with a magnetic field, that the further out you go, the less power there is. And it's almost like a 1/x squared. So every inch you go, you've lost a half of your power. And so when you penetrate, if you're trying to get to like a shoulder, like an AC joint or a shoulder that's frozen, applying the area, a low power isn't going to reach it in a short period of time. So when you have a higher power, you can use that. In fact, I have a patient right now that I'm working with, frozen shoulder, and it's her 5th treatment. And she went from a 0 to 10 scale as far as pain. Now she's down to a 2. And she's getting more movement in there. She's able to sleep now because the pain is gone. And those are some of the great reasons to have a high power and to use it in a clinical setting. Let me just do a real quick check here on looking at our chat room, and I want to finish talking about the potential what PEMF does. So it's going to work in the cell membrane potential, and also the oxygen as far as the partial reoxygenation. And if you've seen any of our videos as far as how that whole Krebs cycle works, where it goes around and it creates the ADP over ATP, it refreshes muscle, it helps reduce inflammation quickly. Again, you can do it quicker on high powered. Low powered is still going to work, but it's going to take more time. And hopefully that helps answer any questions on the difference between the two. As always, enter your information down below if you have a question. Also, be on the lookout. If you're brand new to PEMF, we are creating a kind of a library of a couple of videos that walks you through all of this. We'll have that link, but if you are interested in that, feel free to put your name and contact information below there. And once we get that product live, it should run next week. We should be launching it next week. If you want to know more about that, drop in your information down below and we'll make sure that you get that as well. And again, this is Jerry Dreesen, and I want to wish you a great week. It's sunny here in Seattle, so I'm going to get out and enjoy some of that too. All right, take care.